Hi everyone, a very good day. Hope all of you are doing well, all are in a good health and mind. Myself, Dr. Jogendra Bastia, neurologist, SKS Neuro Super Speciality Hospital, Hyderabad. Dear friends, today I am going to discuss about a very interesting condition, about a neurological disease in which you get paralysis, weakness on one half of your face. So, without wasting time, let's start the discussion. Have you ever woken up one morning, looked in the mirror, and noticed that one side of your face is not moving? Your smile looks uneven. Your face is bending to one side while talking. Your eyes not closing on one side. And suddenly you feel panicked. Is it a stroke? Is it permanent? Dear friends, don't worry. Today we are talking about a condition, one side facial paralysis, which is called Bell's palsy, a condition that may look scary, but with the right treatment, most people make a complete and full recovery. So then, what is Bell's palsy? Bell's palsy is a sudden weakness or paralysis of the muscles on one side of your face. It happens when the facial nerve, also known as the seventh cranial nerve, becomes compressed or inflamed and get damaged. This nerve controls your smile, your eye closure, and even your sense of taste on one half of your face and tongue. When it is not working properly, one side of the face droops and the face deviates to the other side. Then how does it start? The onset is usually very sudden, within hours. People often notice symptoms peaking within 48 hours. Imagine being fine in the evening and then suddenly struggling to blink or smile by the next morning. That is how fast Bell's palsy can strike. How to recognize it? What are the symptoms to recognize that it is a Bell's palsy? You will notice there is sudden drooping of one side of the face. While talking, your face will bend to the other side. You will be unable to close on one side of your eyes. There is drooling of saliva or water or food from the angle of the one side of the mouth. Your speech will be little difficult and slurred. There is loss of facial expression while smiling or frowning on one half of the face. And rarely there can be increased sensitivity to sounds in one ear. Sometimes you may lose taste sensation on one side of the tongue. These are the red flags, and if you see these conditions, don't ignore, because it can be Bell's palsy. But sometimes we get scared. We thought it may be brain stroke. And actually sometimes brain stroke also starts like this. So how to know that it is not a brain stroke? How do we know that it is not a brain stroke? I am going to explain. Stroke usually affects more than just the face. It may involve the weakness of the arm, leg, difficulty in speech, difficulty in your body balance, and many other symptoms, along with weakness on one side of the face. On the other hand, Bell's palsy usually affects only the face. But remember, if you are not confirmed, if you are ever in doubt, treat it like an emergency and get medical help immediately, because better safe than sorry. Then the question comes, why does it happen? Actually, the exact cause is not always clear, but doctors believe it is often linked to some infection, especially some viral infection called herpes simplex virus. And it can happen because of severe physical or mental stress, or in conditions with reduced immunity. Another important condition is exposure to the cold weather for a long time. For imagine you are traveling on bike or on other vehicles and you are exposed to the cold air, rain or very cool breezes for a long time, sitting on the train or bus on the window side, keeping it open and traveling overnight. These are the conditions which may precipitate the Bell's palsy, and rarely it can be part of an autoimmune disorder, autoimmune inflammation. This nerve irritation causes the temporary paralysis. Then what are the treatment? What is the chance of recovery? This must be a very important question, must be coming to each and every patient who are suffering from it. The good news, most people recover completely, 100% recovery for the most of the people if they start the treatment early in the course of the disease. If you start steroid and some other medications within 72 hours of onset of the weakness, it will be very, very helpful. And you have to take proper eye care. Some artificial tear drops, eye patches and lubricants you have to put on the side of the eye which is not getting closed, which is weak. And the most important thing is exercise. Facial muscle exercise is the paramount importance in treating Bell's palsy. Gentle facial exercise is very much important and is very, very necessary for complete improvement, and that will also prevent stiffness which will develop in long run after the Bell's palsy. And the most important is you need patience. Recovery is usually very slow. It may take 3 weeks. In some cases, it may take 3 months. And in very rare cases, mild weakness may remain forever. But for most, the smile returns beautifully. So dear friends, Bell's palsy may look frightening, but it is not life-threatening. With early treatment and proper care, your face and your smile come back to normal. Remember, don't panic, don't delay, consult your doctor immediately. Your smile is your strength. Protect it, treat it, and it will shine again. I hope this video must have been very helpful. You must have learned something new, some new knowledge, some new learning, some new understanding about one-sided facial palsy, Bell's palsy. If you liked it, please press on the like button. Share this video with others. It may be helpful to those who need it the most. One share, one subscription, one like can change the life of the millions. In the next video, we'll discuss about some simple exercises to manage to treat Bell's palsy, one-sided facial palsy, one-sided facial paralysis, that to doing at home. Till then, thank you. Have a very good day. Jai Hind.